Are we addicted to our phones? It's a question that feels, well, it feels really urgent, doesn't it? But the answer is surprisingly complicated. Is digital addiction a real, actual medical condition? Or is it just a buzzword for a behavior we don't really like? To get to the truth, we've got to follow the evidence. So let's dive in and see where the science actually leads us.
And this conversation, it's not just happening in our homes, it is everywhere. As this analysis points out, the whole debate is just buzzing with public anxiety and some serious political pressure on the big tech companies. You know the narrative, our phones are the new cigarettes. But is that comparison even scientifically sound?
And that really brings us to the core question we're digging into today. If you strip away all the headlines, all the politics, does the term digital addiction actually hold up under a scientific microscope? To figure that out, we have to go back to the beginning and see how this idea was born in the first place. So picture this. Researchers start seeing people whose lives are just being consumed by the internet. They're facing a brand new challenge. I mean, how do you even begin to study this new thing? First, you need a framework. How do you define and measure a problem that basically didn't exist a decade earlier? Well, they didn't start from scratch. The most logical first step was to look at disorders we already understood pretty well. They took the diagnostic criteria for things like substance abuse and pathological gambling and basically tried to overlay them onto this new internet behavior. This table here really shows you how those early researchers tried to pin this all down. You can see the overlap in these three really influential models. They all agree on things like preoccupation, constantly thinking about it, and conflict, where it's causing real problems in your life. But if you look a little closer, you start to see the first signs of trouble. The way they define concepts like tolerance and withdrawal gets a little inconsistent, and that's right where this whole model starts to crack. And yeah, those little inconsistencies, they were really just the beginning. It became clear, and pretty quickly, that this direct one-to-one comparison between a substance addiction and a behavioral one, well, it had some pretty serious problems. Okay, let's just take the idea of tolerance. For a substance, it's a clear-cut physiological thing. Your body literally needs more of a chemical to get the same buzz. But for internet use, tolerance is defined as needing more and more of the activity to feel satisfied. It sounds similar, but it's a critical difference. One is a physical, biological demand. The other is a psychological desire. And that distinction turns out to be key. And this is a major, major problem for the whole theory. As one critical review put it, two of the absolute pillars of a classic addiction diagnosis, tolerance and withdrawal, they just don't seem to fit very well with high internet use. Without that clear biological piece, the entire foundation starts to feel, well, pretty shaky. This brings up a huge question. I mean, think about someone who is just incredibly passionate about a hobby, right? Like chess or running marathons. They might be totally preoccupied with it, and they might feel pretty down if they can't do it. So, using these criteria, how do we tell the difference between that kind of passionate engagement and a genuine pathological disorder? The line gets really, really blurry. This quote just nails the core problem perfectly. The internet isn't one thing. It's a platform. It's a place with countless different activities, from gaming to social media to doing research. You're not addicted to the liquor store itself. You might have a problem with something specific you find inside it. Okay, so maybe addiction isn't the right label, but that doesn't mean there isn't a real problem here. We know for a fact that for a lot of people, heavy internet use and mental health struggles really do go hand in hand, which leads us to that classic chicken and egg question. Which one is causing the other? The evidence for a connection is really strong. This 2018 study, for instance, is just one of many that found a super clear correlation. College students with heavy internet use patterns also reported higher levels of depression, anxiety, and this thing called interpersonal sensitivity, which is basically a clinical way of saying they felt more easily hurt or rejected by others. But this correlation leads us right into that classic dilemma. Is the internet causing these mental health issues, or are people who are already struggling with depression and anxiety turning to the internet as a way to cope, maybe to escape, or even to find a connection they don't have elsewhere? The research shows that both can be true, which makes finding a simple answer incredibly difficult. For years, the whole debate was kind of stuck right there, but a recent, really landmark study just gave us a huge piece of the puzzle, one that might just change how we look at this entire problem. It starts by challenging the one thing that most of us just assume is true, that the biggest sign of a problem is simply the number of hours you spend staring at a screen. And here is the bombshell.
A groundbreaking new study tracked over 4,000 kids for 4 years, and the results were just stunning. They found no significant link between the total amount of time a child spent on screens and their mental health. Let that sink in for a second. Our entire focus on screen time might be completely misplaced. So if it's not the hours, what is it?
The answer wasn't about how long they used screens, but how they used them. As you can see in these patterns here, the researchers tracked kids over time and found 3 different paths: a low-use group, a high-use group, and this crucial third group whose addictive style use actually increased over the years. And here is the staggering result. The kids in those high and increasing addictive use groups, they had a 2 to 3 times greater risk of suicidal thoughts and behaviors compared to the low-use group. It's not the time, it's the trajectory. It's that pattern of troubled, addictive style use that matters. So, where does all this leave us? This new evidence forces us to take a major step back and rethink our relationship with technology, and that starts with the very words we use to describe it. You know, the scientific consensus is definitely shifting. It's moving away from that loaded, complicated term addiction and towards something that's actually way more useful: problematic use. And this isn't about the behavior itself. It's all about its real-world impact. So what is problematic use? It's defined simply by its consequences. It's when your screen use, no matter how many hours, starts getting in the way of the important things in your life: your work, your school, your relationships, your responsibilities, you name it. So ultimately, this research is telling us we've been asking the wrong questions. It's not about minutes and hours, it's about function and feeling. The real questions we should be asking ourselves are these: is my technology use getting in the way of my life? Is it causing me actual distress? Do I feel like it's out of my control? So while digital addiction might not be a clean, clear-cut diagnosis, problematic use is a very real thing with very serious consequences. And what the evidence suggests is that the solution isn't some simple one-size-fits-all rule. The investigation, well, it ultimately comes back to each of us. So forget the scary headlines for a second and just ask yourself, what does my relationship with technology actually look like?